Good afternoon, everyone. My name is Elizabeth Aloni, and you are here for a very important webinar called Senior Care. You don't have to go it alone. Just to introduce myself and Schneps Media, we publish over 80 newspapers, magazines, websites, webinars, podcasts, and events throughout Queens, Brooklyn, the Bronx, Manhattan, Staten Island, Long Island, the East End, Philadelphia, now even Florida, Palm Beach, Florida. Unbelievable. So we are thrilled to be able to bring you this panel of experts to talk about something that is so important to help our loved ones at home, stay at home to ensure top quality care. So let me introduce our panelists for today. First, please welcome Donny Tuchman, CEO, Cobble Hill Lifecare. Donny has been the CEO of Cobble Hill Lifecare, a healthcare organization in Brooklyn for over 4 years. Recognizing the need for helping the community live longer, healthier lives in their own home, Donny expanded the services of the skilled nursing facility located at 380 Henry Street to include Your Choice at Home, a certified home healthcare agency. Welcome, Donny.
Thank you so much.
Wonderful to have you here. Next, please welcome Dmitry Sidanov. He's the Administrator and Director of Patient Services of Your Choice at Home. For over 7 years, Dmitry has been the Administrator and Director of Patient Services, which is a part of Cobble Hill Lifecare. Dmitry oversees daily operations of a home care agency that provides skilled nursing and rehab services to patients in their homes with special focus on preventing hospitalizations and promoting healthy aging. Welcome, Dmitry.
Thank you. Thank you, Elizabeth.
Absolutely. Next, please welcome Dr. Alex Aksanov, PT, DPT, MHS. Alex received his doctorate in physical therapy from New York Institute of Technology and a master's in health science from Drexel University. Alex has extensive experience in the acute care and home health settings. He's currently the Rehabilitation Supervisor at Your Choice at Home for the past 2 years, where he oversees all clinical rehabilitation operations. Welcome, Alex.
Thank you so much.
And finally, please welcome Doris Rodriguez. She's a registered nurse, expert medical services at home. She's a strong believer in the delivery of quality medical care. Doris regularly develops comprehensive programs that promote safe aging at home, prevention of hospitalizations, and proper utilization of home care services by close collaboration with other service agencies. She knows there's no single approach that works for everyone, so she continues to educate herself on emerging healthcare trends to provide the most comprehensive program that works for each individual patient. She received her education at Southwestern University in the Philippines with a bachelor's degree in nursing. As a registered nurse, she comes with a vast nursing experience in population health, home care, geriatric long-term care, intensive care, medical, surgical, and wound care. Wow. Welcome, Doris.
Thank you, Elizabeth.
So I'm going to get started. My first question is for Donny. You know, as CEO of Cobble Hill for the last 4 years, 4 to 5 years, right? I know you provided high quality nursing care for many years before that. So why did you start providing home care?
Amazing question, Elizabeth. Thank you so much for asking it. So actually, I've been to Cobble Hill Lifecare for over 20 years.
Wow.
And yeah, it was about 4 or 5 years ago that I became CEO. And over the past 20 plus years, I've watched the transitions of care, and I've watched the needs of aging seniors change. And we recognize that there were many, many, many people who did not need to be inpatient in a skilled nursing facility or in a nursing home. And we feel so passionately about independence and about helping to keep Brooklynites and our patients in Manhattan and Queens and wherever we're able to service, folks, healthy and home. And that's really our passion. That's our mission. There is absolutely a need for inpatient care. And there are many seniors who at some point do get to the point where they do need inpatient care, but there are so many that don't. So we started this business, and I would mention that we're a nonprofit, a mission-driven organization, and our mission is to help keep our seniors, help them age more gracefully, and to do it as successfully as possible, while maintaining as much independence and quality of life. And this was a major part of our expansion into the community to bring services to where patients are and where people are living. And one other thing I'd want to add to that is that certainly since COVID, I think this has really highlighted this, is that oftentimes healthcare is reactive, meaning we wait until we have a major decline. We wait until we're really sick and we have to go to the hospital. And now we're facing, some pretty serious, difficult decisions about what we do with ourselves. But I think what COVID did was it kind of shined the spotlight on we can do a lot and you don't have to do it alone. You don't have to go it alone, which is really the theme of today's webinar. And utilizing services, we don't have to wait for the decline, that there's an awful lot of opportunity for us to maintain our health, our independence, avoid those declines, avoid the hospitalizations, and live the best lives that we can. And I think that's our home care agency is a vehicle through which we are able to service so many aging folks and enable them to do that, to avoid decline in the first place, and to live as healthy as possible in the community.
I love that. I think, prevention, right? They always say prevention is the strongest medicine, and how wonderful it is to be able to do those things to prevent the decline. And also, too, is, making a decision when you're in a bad state. It's very hard to make thoughtful, best decisions when you're in a state of stress.
That's such a great point.
Making those decisions when you're in a good place, it allows you really to make those right decisions for you. Thank you so much. Those are some wonderful benefits. I appreciate it. So I'd like to get a deeper dive into what kinds of care happens at home. So I'm going to turn to Dmitry. Can you share with me some of the most common conditions you treat at home and what kind of treatments that you can provide at home?
So we provide home care for patients with various conditions. However, there's certain conditions that cause most hospitalizations and most debility. So, for example, conditions like congestive heart failure, chronic obstructive pulmonary disease or lung disease like emphysema, diabetes, high blood pressure, orthopedic conditions, and wound care. These are these are the main conditions that we treat, but we treat various conditions, whatever makes patient go to the hospital or affects their activities of daily living. We are there for these patients. We provide in-home physical, occupational, speech therapy. We provide registered nurses to monitor patient, to ensure that the patient is following doctor's care plan. We help patients with medication reconciliation. We provide services post-operative care for patients who had surgeries. We provide services post-acute care. In other words, any condition that made patient go to the hospital, we are there after patient comes out. Falls prevention, pain management, and as we also provide home health aid services to our patients to help them with activities of daily living and personal care. Once they come out of the hospital, once they come out of the rehab facility, or simply if they're home, to help them regain those the way they used to function, and to help them to be more independent and stay at home as long as possible.
Let me ask you this. So do you, a patient comes to you and they want home care. Do you help oversee the management of all the different care? Because honestly, I think you should give us a list of what you don't take care of, because it's like so extensive of what you do. But how do they manage all these different, because typically a patient has multiple needs.
All our nurses, as soon as the patient actually being referred to us, we assign a coordinator or nurse coordinator. All our patients have nurse coordinators who coordinate their care. What does it mean, coordination of care? They communicate with all the disciplines involved, from the physician to rehab specialist, to the aide. Everything is being coordinated, and basically all this information is being monitored by the nurse. So yes, we coordinate every aspect of the patient life, including even if the patient needs a financial management. We also assist with that. I forgot to mention we have social workers that help with that. Any kind of community entitlements and all of that, we assist as well. Our main goal is to keep the patient at home, for them to be healthy and for them to be happy at home. As a matter of fact, we also, and I know we're going to talk to Doris later, but we also provide visiting doctor service, so that patient doesn't have to go to the doctor, especially physically go to the doctor. The doctor will come to their home, especially after they come from the hospital. They feel tired, they feel exhausted, they don't want to make appointments, they don't want, we will send the doctor to them. And basically all the services that we provide are to prevent patient going back to the hospital.
I know you've talked about, how this can help patients be healthier. Can you talk a little bit about that?
Well, I wanted to mention, Elizabeth, you can put the slide. I wanted to mention just right now, quick tips.
Recording has stopped. This meeting is being recorded.
Sorry about that. Here you go.
So these are I just wanted to quickly just introduce a couple of tips, what to do now before home care, before anything, to prevent patients from, or people who are in the community right now going to the hospital. So we will start with, and I mentioned other conditions, but these are the three most common conditions that make people go to the hospital. First one is congested heart failure. Stay active. Try at least 2 hours a week of low to moderate exercise. Walking is perfect. And try not to sit around more than 2 hours a day. That can raise your heart failure risk. And of course, you need to check with your doctor before starting any exercise. Treat other conditions. Most of the problems that happen with congestive heart failure are due to other conditions like high blood pressure, diabetes, high cholesterol, and overweight. Eat right. Limit saturated fats, extra sugars, salt in your diet. Instead, go for fruits, vegetables, low-fat dairy products, and lean proteins. And choose good fats. From olive oil, walnuts, avocados, and fish like salmon. Don't smoke and limit alcohol. Manage stress, and good night's sleep is very important. Then we move to diabetes. Reduce total carbohydrate intake. Basically, eat food that are that have less refined carbohydrates and sugar, that will increase the blood sugar and insulin levels, and which may eventually lead to diabetes. Limiting total carbohydrate intake and choosing options that don't cause blood sugar spikes. That will help to reduce the risk. Exercise regularly. Like I mentioned before, any kind of exercise, especially walking, it's really good. Exercising regularly may increase insulin sensitivity, and which may in turn help prevent diabetes and insulin levels. Try drink water as a primary beverage. Drinking water instead of sugary beverages may help manage blood sugar and insulin levels, and therefore reducing risk for diabetes. Try to lose weight. Modest weight loss will significantly reduce your risk of diabetes, particularly if you have excess abdominal or belly weight. And reduce meal portions. Avoiding large portion sizes may reduce insulin and blood sugar levels and promote weight loss and decrease your risk for diabetes. And last is the falls prevention. Right, you can do this right now. Basically, clean up the clutter, remove tripping hazards like loose rugs or wires. Wear comfortable shoes. Install grab bars and handrails. Brighten your home with more light. Move slowly, and use assistive devices. So these are the tips that you can do right now to prevent going to the hospital.
think you make a really good point, even putting on an alarm every 2 hours to get up. Because I think, sometimes we don't even realize that we're sitting down. If you could just get up and move around a little bit, each day, it's really
For sure.
make a big difference. Thank you so much for that. So I wanted you to share with me a little bit more about, the qualifications. So does someone have to already have been in a hospital? You mentioned about leaving a hospital. Do they have to have been in a nursing home to get home care assistance?
No, the patient, no, there is no need to be in a hospital or rehab facility. The patient can be just home. Something happened. Maybe, the patient is not moving as they used to. Maybe there is a new diagnosis, new medication. Any change, anything new that may require skilled nursing, therapy, we're there. So there is no need to be in a hospital or a rehab facility. So patient can be home, and as long as there is a need, we'll be there. Like I mentioned, skilled need is the most important thing. What does it mean, skilled need? The patient needs to have something for us to come and do in order to prevent hospitalization. So it could be anything from high blood pressure or unstable blood pressure, unstable blood sugar, like I mentioned, new medications, or simply when patient is not able to take medication. Maybe they have a vision problem and they will need a nurse to pre-pour medication and medicine so that they can take it at appropriate time and appropriate days. So anything that may require nursing or therapy, we're there. So no need to be in a hospital.
And nobody yes, right? I mean, they could reach out if they're not sure,
Of course.
Hey,
of
this
course.
sounds great. I want my loved one to have a healthier life. I want them to be able to stay at home. They want to be able to stay at home. I don't know. Reach out and we will provide your contact information for people to do that.
Thank you.
Can you share with us?
Can I jump in for just 1 second? I thought you raised two amazing points. I just wanted to connect them. In terms, caring for, aging and caring for an aging loved one could be very challenging, and it can be stressful. And I know from personal experience, that one of the biggest stressors is like the who do I talk to, and who can I go to for information, and how do I know how to handle this? And I'm scared. And I think one of the benefits of working with the home care agency is that you have just that, someone to go to help coordinate the care, to evaluate and assess what are the needs. There have to be needs, as Dmitry pointed out. But we're expert, and others like us are expert in trying to identify what those needs might be. So you don't have to have it all figured out on your own. But it costs nothing to inquire and to have us come do an assessment and to see really what services you or your loved one might be appropriate for.
And what would be the best way for people to do that as a next step, Donny?
Dmitry, do you want to talk about how to reach out and connect with us?
I mean, the best way is just to give us a call at 718-855-7080, and we will provide all the information. We will send the nurse to evaluate, to see if there is a need. We'll explain everything, and even if there is no need for home care, we may refer the patient to some other community services. So so just give us a call.
In fact, I would even add to that because we're embedded within the Brooklyn community and we've been here for so long, we have relationships with many folks in the community who just call us periodically to update us, talk to us, ask us for some advice, and they don't actually need our services for many years, but they know us, we know them, and it's a very low pressure, kind of a conversation. But I just know, and I feel for people who are struggling alone, not knowing how to access information. That alone is valuable in and of itself, in its own right, in order to navigate sometimes the complexities of aging.
100%. I put that phone number on your website also in the chat so people can grab it. And also everyone, you will get an email tomorrow with that information too, so that you can reach out and just, why not you want to give yourself all the tools in your tool belt. You want to know what's available and what's possible. And so that conversation is never too soon to have. Dmitry, can you share a little bit, in helping people be healthier? Can you give us a real life example?
Yeah, I mean, we have tons of examples, but I just remember one in particular, and this is very common, and this is why I wanted to mention this. So I remember that there was a patient that was in a hospital, and this patient's mother, this patient's daughter was in another state. And the elderly patient had a hip replacement and was ready to come out, but the daughter couldn't come. She basically called us and wanted help. Right. So, what we did is, first of all, we obviously we contacted the social worker from the hospital. We arranged for the aide to pick up the patient from the hospital. We do this as a free service to our patient. We pick up patients from hospital. There's no one to pick them up. So we send the aide to pick up the patient, gather their stuff. Then they got home. As soon as they got home, the nurse came in, assessed the patient, admit patient to our program. Now, we also send our therapists to what we call is to do home modification assessment. Basically, we wanted to see if the home is appropriate for the patient, what equipment the patient may need. We ordered the equipment. We send physical therapy, occupational therapy to start therapy after hip replacement. Now, I forgot to mention one thing, that the patient herself, she did not want to go to the rehab. But this is a very common situation where after any kind of orthopedic surgeries, usually patients are being referred to a rehab facility so that they can get the therapy there, and then they discharge them home. In this situation, the daughter and the patient were adamant they wanted to go home. They didn't want to go to any hospitals, to any rehab. So that's why we had to take over, bypassing their rehab and provide all the services. So the nurse like as mentioned, we send the physical therapy, occupational therapy. We looked at the patient as far as the equipment, as far as the need for assisted devices. We ordered everything. The nurse assessed the patient and did the medication reconciliation. Remember, this is very important. One of the main reasons why patients go back to the hospital is because there were medications prescribed to them before the hospitalization. In a hospital, physician prescribes more medications for them. And when they come home, a lot of times they don't know what to take. And some medications, they look familiar, similar to, and a lot of times they either take double down. They take the same medication twice, and it's a huge problem. So the nurse was able to check all the medications, told the patient what needs to be taken, when, and what dosage, and so that was addressed as well. Then we made the physician referral. So we referred to expert medical for the physician to come and see the patient post hospitalization. A lot of times, when patient comes out of the hospital post orthopedic procedures, there is a pain, and we wanted to make sure that we address that. And patient, she had no one to help her, so we had to send the physician. She could not go physically to the doctor's office, so we sent expert medical physician. The physician, took care of the pain management, and we worked together with the physician to make sure that the patient takes the appropriate medication at the right time. We also provided.
I have to stop you for a second, because I just think, like, wow. I just feel like a weight is lifted off my shoulders. I'm thinking about, how wonderful her daughter must have felt, and understanding as you're talking about it, I don't think I would ever know all that I would need to do to take care of my mother and to make sure that all of her needs were met. So, I mean, yes, this is keeping your loved one healthier and safer. but it's also like what a weight off of your shoulders to know that they're in their beautiful home that they love, that they're comfortable with, and getting all of this attention and help.
And absolutely, they recover faster, at home in their familiar environment, they're more compliant with the treatment, and they don't have to go anywhere. They're literally,
it's hard to imagine, Dmitry, because you're talking about physical therapy. So I want to turn to Alex to learn more about that, because how do you do that at home?
So what we try to do is make sure that first and foremost, the environment of where the patient is, it's safe for them to be walking around, whether it's inside and also, hopefully also outside, because as we know in New York City, a lot of the places that people live are very tight, very small. So we want to make sure that people are able to get in and get out of their homes safely. The other thing what we do is we make sure we work on what impairments and what activities that the patients have trouble doing, whether it's going outside, using the stairs, whether it's being able to improve their standing duration, whether it's sitting and standing and going to the bathroom. We focus on making sure that all the daily activities that they are having trouble doing, or whether it's also like things such as playing with their grandkids. We focus on activities that they have trouble doing on a daily basis. And we work with them, not only with them, but their caregivers, their families, and their whole support team to make sure that they're working towards getting back to where they were beforehand. We also make sure that they have exercise programs when we're not there, to make sure that they're doing things on a daily basis consistently. Because as we know, the best cure is repetition. The more you do something, the better you get at it. So we want to make sure even after our services are over, that they have something as a guide for them to continue living a healthy and prospective lifestyle.
And you can do that at home because, when Dmitry said earlier, make sure you do, exercise. I look at my spin bike. I'm like, no problem. But then, you think like you've just had hip surgery. What kind of exercise are you doing? But you actually give them exercises that they can do on their own, so they know where to turn for that.
Yeah, absolutely. And that are specifically tailored to what procedure they had or what impairments they have, because we want to make sure that it's individual specific and it fits what their specific goals are. We want them to be able to be as independent, as functional in the community as best as they can be.
I would think that's a very big piece to it, right? Because to be able to be feeling good, you have to be able to move and be able to heal from surgeries. So that's really incredible that you can do all of that at home. Can you share, Alex, us another, I love hearing the real life examples. There's nothing like them. Can you share one of those with us?
Absolutely. So we had a patient who lived in her apartment and she wanted to go outside to go to the local grocery store to get groceries. She didn't like having groceries delivered to her. She wanted some more variety, some more independence. And the problem was that she didn't have an elevator. She lived in one of those brownstones where there were only stairs to go up and down. So what we focused on was to making sure that she was not only able to get to the stairs safely, but walk up and down slowly and carefully within the constraint, within her availability, within how she can, and to be able to go outside and then slowly to go to the grocery store. And she was, by the end of the treatment course, she was able to do so.
Wow, that's incredible. And it didn't take any kind of Herculean equipment or any, really it was just about teaching her how to move, it sounds like, and be able to do it slowly and be able to feel confident.
And correctly. We have to make sure that they're moving correctly and they're safely, because they could be moving, but God forbid there is some kind of something in front of them where they can trip and fall. We have to be always making sure that they're being safe, always looking around themselves, around their environment, and walking and doing all the activities as they did beforehand.
I love it. I'm picturing her at the supermarket picking out her own oranges. It's like picking out your own fruit is your own thing. It's not the same when someone delivers you their fruit. You want your fruit. So I totally get it. That's wonderful. Thank you so much, Alex. So I want to turn to Doris. Doris, can you share about the kind of services that you provide at home?
Of course. So we are a group of home visiting doctors, NPs and PAs, physician assistants and nurse practitioners that provide services to the homebound elderly patients at home. So our main goal is safe aging at home, prevent hospitalizations and rehospitalizations. We work very closely with home care agencies such as Cobble Hill, Your Choice at Home, where we share the same goals. So pretty much we see these patients for different reasons as a primary care provider. So we do see them monthly at home just to make sure everything is well maintained in terms medically, or we see them on emergent cases, such as if a patient falls at home, Dimitri's team or Alex's team would let us know that a patient just fell and they are entertaining some trauma, either a dislocation or a fracture or just a soft tissue swelling. We can do x-rays at home.
What?
We do blood tests. Yes, we can do EKGs. In terms of CHF, if they're entertaining a CHF exacerbation, we can do echocardiogram at home. In these cases, usually these are hospital conditions, but we do treat them at home. If we know that based on the echocardiogram, there's fluid retention in the heart and in the lungs, we can treat them. We can start treatment modalities at home.
Well,
So,
treatment is
yeah.
really very extensive with what that you can provide for someone at home. And then it sounds like you kind of are the constant touch point that
Yes.
the patient
Yes.
has with you, and you're able
Yes.
to bring in, people like Alex and,
Mm.
when it's necessary.
So their population is essentially as the same as the population that we serve. These are the homebound elderly folks that have difficulty going to the community, to their community doctors and stuff. We are there to assist. If they would still want to, they can still continue to see their primary care providers if they do feel better after hospitalization, after surgery, if they're after their physical therapy, if they're well enough to walk and to get to their doctor's offices, then you don't have to stay in the case.
Well, that's a good point, because I had that question. I think that's a question that many people have. If my mom or I decide to be at home care, do I have to switch all my doctors?
No, not necessarily. So while they're homebound and they're deconditioned from prolonged hospitalization or from different disease conditions and stuff, then we come in once they feel better and they want to go back to see their PCP in the community. They're free to do so.
That's great.
And we can discharge them from our services.
Okay, that's good to know for someone who may want to continue with some of their own doctors. So
yes,
this information is so wonderful and inspiring, really, to hear all the services that can be provided at home. But I wanted to ask a bunch of questions, and maybe we can bounce to different one of you, each of you, as you has the answer. But do you find that patients sometimes sabotage their own progress, like not taking their medication or eating the wrong kinds of food, or Alex maybe not doing their exercise? Do you find this as a problem, and what do you do about that since they are at home?
So basically, it's really just patient education is the key. I'm not sure if they are aware that they are actually sabotaging their own progress. So education is the key there, and constant closer monitoring as well. So in that sense, we're talking about the high risk population, which are your diabetics, your congestive heart failure patients, your COPD. We can also add remote patient monitoring at home, wherein in real time we know what the patient's vital signs are at home, and we can interact with them at any given time. Yes.
Wow.
So if we have a patient that the sugar happens to be over 300 before breakfast, then we know something's wrong. It could be due to an infection or mainly just non-compliance to medications. So we can right away eyeball on that issue. Through remote patient monitoring, we can see them, two-way video call, and sometimes they're not even aware that that's the result that they got, and we will know that, by
I mean,
monitoring through a remote platform. Yeah.
mind blown, because honestly, I mean, that is so, because sometimes, a senior might not feel well and not know why.
Exactly.
Right? And you could so easily help them understand.
Mhm. And then we call their visiting nurse, whoever, if they are already active in the program, we call whoever the nurse is. The nurse will come to check on the patient at home, and then the doctor will also visit, either via telehealth or actual home visit. So as per CMS, there's no limit to how often the patient can get a home visit from a physician, as long as it's medically necessary.
Okay.
Yeah, as long as there's a reason for the visit, then they can just, give the home care agency a call, and they can, or give us a call directly, and we can certainly make that happen.
Great. And so how often generally are home care providers visiting the home? Is that
For doctors?
I guess it's, a team, right? Because you have doctors, nurses, physical.
Maybe Dmitry can answer to that. Yeah.
Yeah, I think it all depends on the patient, because we cater to the patient specific needs. It could be weekly to daily, depending on the need. Let's say if it's a wound care patient, we have a wound care specialist who sees patients daily and changes the dressing. On average, weekly, at least weekly. Again, we adjust it as we go. So if we see there is a need, we see patient more often. As far as physical, that's nursing. As far as physical therapy, occupational therapy or speech, also it's very individualized. But on average, about 3 times a week. It all depends on the patient. As far as the aid, it's the home health aid, usually 2 to 3 times a week as well, for about 4 hours a day.
Wow.
These are just general numbers.
And this all seems so incredible, but I think I have to address the gorilla in the room, because although it sounds really incredible, it also sounds very expensive. So how does someone pay for home care?
So, it's all CHA or Certified Home Health Agency services are covered by all major insurances. Most are covered, especially with elderly, by Medicare, Medicaid. Medicare, I would say, number one insurance that covers, and without any out-of-pocket expenses. So, yeah.
Okay. And that's something that people can discuss when they are in touch with you?
Absolutely. And we can actually, if there's the need, to verify insurance, to help with the insurance, we assist with that as well. I just want to quickly mention, as far as, we're not just, once the patient reaches the goal, we're not just discharge the patient in the community, but we also, a part of the discharge plan is to make sure the patient remains safe after our discharge. So we help, make appropriate referrals so that patient has services, some kind of assistance after we discharge from a home care. So I just wanted to mention as well, we're not just dropping the patient. And as a matter of fact, our number one referrals are former patients. So they call us. If something happens to them, they call us back. So they keep in touch with our nurses.
Well, look, the goal is for you to be able to assist them, and them not to necessarily need assistance as well, is a wonderful thing. And, people are living longer, and we want we all want best care for ourselves and for our loved ones, and we want our loved ones to live their best lives. So, Donny, from your vast experience, can someone, and if so, how can someone avoid declining health as they age? Because really, right, that's what we all want.
Yeah, I mean, I think I'm reflecting, and I was listening very carefully to the presentation. There are so many things that are within our power and our control. There are some things that are not, but there are many that are. And lifestyle really does matter, and it's never too late. I want to really encourage everybody. It's never too late to get a little bit more active. To focus more on our nutrition and our hydration, making sure that we're eating right and that we're drinking right and that we're sleeping well, because sleep is an incredibly important part of living, of life. One that we really didn't mention is social interaction. It's really being engaged with people, being alive, being out there. And even if someone is homebound, one of the benefits of working with an agency such as ours is that there's interaction. There are people to talk with. They're coming into your home. It's almost like a family and a network where we're keeping people alive and living, good quality lives. And I think one of the benefits of a CHAV, a certified home health agency, is because it's short-term care. A person can live for many, many, many years and take the services when they need them, and then they're discharged when they've graduated. And then when they need them again, they come back and we bring services back. And we could do this for many, many, and we've had many cases where we're over the course of 5 years, 10 years, we're going in and we're coming out. And we see this a lot. So I guess my main my takeaway from this topic is that going it alone is really difficult. And living in isolation is really difficult, and managing the inevitable declines of aging can be really stressful and difficult. But when there's a network, when there's others to talk to and to consult with and to brainstorm with and to look at me or my loved one's needs, it makes the burden tremendously lighter and easier to navigate. And then to remember that there are things that we really can do even now, wherever we are in our lives, that'll help make our lives better, and they'll improve them. And that we shouldn't overlook the small things. Yes, oftentimes healthcare is driven by the big, massive events, but the small things add up tremendously. So let's all commit to living more healthy lives, more engaged lives, pursuing things that are of interest to us. There are so many older folks that are living wonderful, rich lives, and are doing things. I was just watching a video this morning about a mountain biker. It's a senior citizen, and she's a mountain biker, and she didn't start riding until she was like in her 50s. Wow. And it was like, I was like holding on like dear life watching this video clip, because I'd be scared to do it.
I won't even let my son do it.
Exactly. But to me, it really resonated, because the point is, like, it's never too late. And we have one life to live, and we want to live it well, and we want to enjoy our time. And I think realizing and recognizing what services are available, and they usually cost us nothing. We just have to know about them and to find the right ones.
Wow.
So I think those are some takeaways that I'm sharing.
Phenomenal. No, what a beautiful, perfect way to put it all, for sure. So we have a few questions that our attendees posed that I would love to be able to get to before we say goodbye. And you've been also generous with all your information. I appreciate it. Tina wanted to know, how long does it take to set up home care? So Tina's ready.
We start home care as soon as basically within 1 day. It depends on the patient. As soon as they come to the hospital, it is to the patient benefit for us to start as soon as possible. We don't want any delays. We want to start as soon as possible, again, to prevent rehospitalizations. So yes, if a patient is coming out of the hospital today, depending obviously on the time, basically within 1 day we're there.
Wow. Okay.
Sometimes the same day. It depends.
I would just add to that gap in time, the transition in care from one healthcare setting to another or back home, is critical. So we come in even before a patient goes to the hospital. But if so, and we set up services, based on what the assessment determines. But if someone is in the hospital already and either they're going straight home or they're in a rehab facility and going straight home, managing that transition is really important to make sure that everything is accounted for and there's no gap. And the speed of getting our clinicians into the home to set up services is really key for success. That's a great point about how quickly agencies can set up services.
That is incredible. So I never would have thought you would have said that. Diana wanted to know, do you address patients with memory and dementia issues? And if so, how can you help a loved one with these issues?
We don't. So as far as now, if the patient with diagnosis of dementia needs skilled services, so as far as therapy, skilled nursing services, yes, we do help. And a lot of our clinicians are trained how to deal with patients with dementia. However, if it is a custodial care, just to assist at home with the home health aid, we don't do that. In other words, in order to be on our program, the patient needs to have a skilled need. For something for the nurse or for the therapy or for the physician to come to prevent hospitalization, to prevent deterioration.
Donny,
So yes, we do treat patients with dementia and mental conditions, but in addition to physical conditions.
We also provide dementia screen and assessment and start treatment if need be.
Great. Donny, did you want to share something about that?
Yeah, I just wanted to say that to explain again, to reiterate that to qualify for CHA services, there has to be a skilled need, and simply having dementia would not qualify. Oftentimes, though, along with the dementia, there are qualifying conditions. But I also wanted to add that I totally get, and I have so much empathy for cognitive decline, for Alzheimer's, for all forms of dementia. And I think that's a tipping point where we have worked really successfully with people in the community who weren't yet ready for CHA services, but we were a resource for them as their loved ones proceeded with their dementia, for just some strategies for how to manage it best in the home, in the community. And a lot of it is really subjective to what kind of family support there is, and helping make that determination for how long can that individual live successfully in the community, and at what point they need to consider an inpatient setting. But if there's anyone on this webinar that wants to talk this through, we're more than happy, to jump on a call and just to hear you, talk to you, let you vent, share your experiences, and we'll be more than happy to try and give you some tips or advice if we have it. And if not, maybe we could refer you to some others that may. But we're here for you in every which way.
I like that. And I just shared the number again, because don't figure out for yourselves, everybody, whether or not this can help. It's too extraordinary just to put on the side and walk away from. So reach out and find out. Someone lives in Westchester and they want to know if you service Westchester.
Unfortunately, no. We only service 3 boroughs: Brooklyn, Queens, and Manhattan.
Okay. All right. So move.
But if someone reaches out, we might be able to make some recommendations or just help you connect you with somebody.
That's wonderful. Thank you for that. Also, someone wants to know, and I think we touched on this, but just to make sure, can you arrange for someone to get insurance to cover my care? Not can you make them cover it, but can you help them?
Yes, absolutely. We do this. We do this every day, and just give us a call. We'll help. We'll explore. It's very individualized, so we'll see what we can do for sure.
Wonderful. And Guy wanted to know about long-term care. Can you make recommendations for that?
Long-term home care at home, or long-term home care in?
This person, Guy wasn't specific, but I guess can you refer anything that can't?
Yes. So at home, long-term at home, and we do this a lot. Before we discharge the patient, and we see that there is a need for long-term services, we refer the patient to, which is called the MLTC, or Managed Care Program. This is the long-term home care program where the patient can receive services for a long period of time and stay out of the nursing home, basically. Now, as far as the long-term nursing home, I think Donny would be better to talk about this.
Yeah, I mean, I'm actually reading the question. I think I'm not quite sure what Guy is referring to as a long-term care agent and as a provider. So Guy, if you want to reach out, and be happy to chat with you, individually and see what exactly you're asking, how we could be of assistance. But yes, there is back to long-term care in the nursing home. Again, we here we're looking to for no one-size-fits-all approach. It's very subjective. It's very customized. There are times when we can help folks live long-term in the community with child services, referring them to an MLTC. And then there are times when, together with the family, the decision is made that it's better to transition into a nursing home, depending on the level of care that's needed. Those are very, very sensitive decisions and discussions. They usually don't happen overnight unless there's something catastrophic that happens that makes the family just unable to care for their loved one at all, or they're in the hospital and they just simply can't return home. But I would reach out. I would want to have a discussion with you and really understand the details of that, so we can best support you in that.
That's wonderful. Wonderful. Thank you so much. I am so grateful that you were all here today to be able to share this important information. I know I learned a lot, and I'm excited about what you provide and excited for everyone, who's here to reach out. I have to say, one of the things that's most incredible to me, Donny, your care for people and your team, and you could see how much you all care. And I think, that's something that money can't buy. And that's something that if you find, you want to bring it into your life and into your loved ones' lives. So certainly as a next step, the phone number is 718-855-7080. I did share it in the chat. You will get an email tomorrow with that information as well. This was recorded. You'll get a copy of the recording so you can share it with your family and friends. Please do so. I think it was really enlightening. Thank you so much, Alex, Doris, Dmitry, Donny. Thank you so much for providing information today.
Thank you so much.
Really enlightening and such a valuable time together. And thank you to all of our attendees for joining us this afternoon. We appreciate you. We wish you all to stay safe, stay healthy, and we'll look forward to seeing you on a future webinar. Have a great day, everyone.
Thanks
Bye.
so much. Take care,
Thank
everyone.
you.
Bye-bye.